Now today what we're going to talk about is a really simple question, acupuncture versus cupping. Now these are really common things that most acupuncturists learn, and also tools of, not just tools of the trade in Chinese medicine, but tools of the trade in Russian medicine, in lots of East Asian medicines, and lots of Eastern European medicine. Cupping's a big part of those cultures as well. It's not just part of Chinese medicine, right?
No.
Hi, I'm Marie Hopkinson. Welcome back to the Chinese Medicine Podcast. Today I'm joined by my colleague, an acupuncturist and a Chinese herbalist, Geoff Brothers. Welcome, Geoff.
Thank you, Marie.
Geoff's from Perth. We're filming this in our lovely, almost COVID-free Perth at the moment, in August 2020. And Geoff actually trained at the same college I trained at. We were in some of the same classes and we were kind of like study buddies back in the day. And so Geoff has studied also the classical system of Chinese medicine that you probably hear me bang on about a lot on this channel as well. And Geoff has almost 20 years of practice, or coming up 20 years this year of clinical practice and experience. Before his time in Chinese medicine, he was a graphic designer. So he likes to have, like for all the students watching this, he really appreciates all those lovely, good-looking flowcharts and good-looking study materials. Yep, so he's really into that. Yeah, and so Geoff has increasing his special interest in women's health and fertility. He's just recently joined a new practice. Where is your new practice?
It's down in Netherlands,
Yeah.
Highway, Netherlands.
Awesome.
Yeah.
And they focus on women's health there, right? That's what they do there.
Women's health and fertility.
Awesome. So welcome, Geoff.
Thank you.
It's a great pleasure to have you on the channel. Now today what we're going to talk about is a really simple question, acupuncture versus cupping. Now these are really common things that most acupuncturists learn, and also tools of, not just tools of the trade in Chinese medicine, but tools of the trade in Russian medicine, in lots of East Asian medicines, and lots of Eastern European medicine. Cupping's a big part of those cultures as well. It's not just part of Chinese medicine, right?
No. Cupping has been a part of many traditional systems for many years. I know I've had Greek patients and like Eastern European patients that have come in and, my grandmother used to do that to us, and certainly all the Asian countries and Southeast Asian countries have a tradition of cupping.
Yeah. So we're going to talk about what the difference is with cupping. I've got some cups here. Do you want to hold that one? So do you want to tell the viewers what these cups are? They look a bit strange. We've got a little baby one here and a big one there.
Well, there are different sizes. Marie's just got two sizes at the moment.
Well, there should be some in between.
There's a range. There's a range of sizes. They're basically very simple. They're just a glass cup with a flat base, and that way up it'll sit as well on a desk or something. But really, it's just a vessel to house a vacuum. So we use a flame, typically a cotton ball, with alcohol, which we light up, and we just pop that into the cup for 2 or 3 seconds, and that just burns the oxygen out of the cup, and then we quite quickly put it on the skin, and that vacuum draws the skin up. And I kind of like to think of it like it's kind of like the opposite of a massage, isn't it? Where a massage is really pushing into the body, pushing into the muscles. This is really drawing out.
Yeah.
So it's quite helpful for drawing out the stagnant blood that accumulates in muscles when you have muscle tension and lactic acid and all of those waste products of injured muscles.
Yeah.
So
I often use that analogy. I often tell patients it's like the opposite of a massage, because it is exactly like that pulling. If you've ever had cupping, it sometimes can feel really strange when you first have it. It feels like this weird pulling, but then you relax into it and you feel like, wow, this is so great.
Yeah, and just if you think about it energetically, rather than pushing things back into the body, you want to really be drawing those, let's call them toxins for want of a better word, but you want to be drawing all of those waste products out of the body. And what it does is it takes it out of the deep layers of muscle into the more superficial layers, where the peripheral circulation can clear it quite quickly. So commonly you will get a bruise from cupping, but it's not a bruise in the same way that you get when you have an accident, say, which is like a bleed into the muscle. It's because the bruises or the marks that you'll get from cupping they generally fade after like 3 days or something, don't they? So
yeah, I usually tell patients the longest it could last would be a week.
Yeah.
And that'd be like really not typical, but just in case. Like if you have a wedding or something like that coming up, and I'll tell you something funny that like I was the bridesmaid for my sister's wedding, and I do cupping on myself all the time without thinking about it. If I get a headache or something's wrong, like but type that, I'll just stick some cups on, and sometimes I'll stick them on here because like it just helps. Like you've got tight pectoralis major or something like that. Put the cups on, and yeah.
You forgot you're going to the wedding.
Yeah, because I forgot that the wedding, and I've got this dress on that's kind of like, you know, a scoopy neck, and there's a bit of a cupping mark there. And my sister was like, "What? Why would you do cupping?" And I was like, "Oh no, I didn't think of it." Like, so
just a few love bites.
I know. It's a makeup will cover it, just so you know, but it's not the greatest thing.
Yeah.
But yeah, it's a very common thing where if you do have something that you definitely don't want those marks there for some reason, then you should like allow a week. But that'd be extreme.
Well, I generally ask people, you know, and if it's in winter, they're a lot less likely to have those sorts of events. But in summer, you know, you definitely want to ask somebody, are you going to a wedding or something formal where you're going to perhaps be seen? But I've had a lot of patients say, no, I wear them with pride. You know, a lot of people actually don't mind it. Because we've all seen, there's been photos of Madonna and Gwyneth Paltrow and people like that, celebrities that have had them. So now it's kind of cool.
Yeah. Well, I had a patient recently that complained that they didn't get cupping marks because they came in because they wanted the marks so that they could look cool. Yeah. Because they'd seen them in sporting magazines and, you know, who's that swimmer that's always...
is it Phelps?
Yeah. And he had like lots on there, lots of marks because lots of cupping. And so maybe we can talk about why some people have the marks and some people don't have the marks. Like we're doing the same kind of cupping, right? Yeah.
Well, you generally find it can be due to the strength in which you put them on, right? Yep. That's one factor that will determine how much of a mark you get.
Yep.
And in certain cases, like with elderly people or very frail people, I don't put them on very strongly. But it can also indicate the level of damage in that specific area. So, for example, someone's got neck or shoulder problem, maybe an accident or a sporting injury. You can put a whole lot of cups around the area to basically address any muscle knots, any muscle tension. And what you'll find is that the areas where there's worse stagnation, worse blockage in the meridian, you'll find that those cups will produce more of a bruise. So in some ways it can be used diagnostically to really pinpoint where the problem area is, because when if it's been a couple of days after they've injured their shoulder, it spreads out, doesn't it? And so you've got lots of muscle tension all over, but there's like generally an epicenter, and that will come up the darkest.
Yeah, and something that's really interesting is the more recent the problem is. I don't know if you find this, but the stronger the marks are. Whereas something that's been going on a long time, especially when someone's got a chronic problem, maybe because in Chinese medicine they've become more deficient as well. So there's less blood stasis there, and there's more blood deficiency.
Yeah.
So there's less of these really strong purpley, dark coloured marks. It might just come up red, and that kind of redness goes away in a couple of hours even.
Yeah.
Right. Even with strong cupping. So sometimes it's not necessarily relating to the severity of the problem, it's the recency of the problem that shows you how quickly that is. And someone like the swimmers and the athletes that get it done a lot, and they have these really strong marks, people think, whoa, they must have had a big injury or something's happened. But they're just like hammering their body so strongly that they're producing all this blood stasis and toxins, and it's actually, they're more of an excess type of pathology going on than a deficiency.
Yeah. True.
And that's why they've got those really strong purpley marks. Looks crazy. Okay, so we talked about cupping, just what it is, and the marks and stuff. So I guess one of the things with acupuncture in the big difference is like, well, you're not going to get those marks on your skin from acupuncture, right? So what would be one of the bigger differences, or why would you choose cupping instead of acupuncture or alongside? Why would you use cupping if a person came to you as an acupuncturist?
Well, okay, so a lot of the times I'll actually use cupping in conjunction with acupuncture. I would generally do acupuncture first and then cupping. Some people do it the other way. But Yeah, I guess the way I do acupuncture, I generally would do what we call distal points. So let's say someone's got back pain or neck pain, we might choose points on the meridians, on the arms, the lower arms, the lower limbs.
If I had a problem on my neck, like you said, you've used distal points. What does a distal point mean?
Well, okay, so a distal point is a point at the end of the meridian.
Yeah.
Okay, so what we would do is we would identify which meridian was involved,
Yeah.
and then select a point further along that meridian,
Yeah.
which in the school that I was taught, it was thought of that the distal points strongly invigorate the circulation through the meridian.
Yeah.
Okay,
Yeah.
so, and the way I explain this to patients is, let's just, if we think of the meridian system like say a reticulation system in your garden where you have water flowing. So we've got chi and blood flowing through the meridians. We have an injury here on the shoulder, so we've got a blockage in that reticulation.
Yep.
So none of the chi and the blood can't move through that area. So we want to undo the blockage at the problem area, but then we want to turn the tap up and increase the pressure through the meridian to get it to flow through.
Yeah.
So
so these points here will turn the tap on,
Yeah.
increase the pressure.
Yeah.
Yeah. And that's sometimes why these points in acupuncture feel so strong, right? Like patients can sometimes jump up like they're, whoa, that like really strong feeling points, right? Yeah.
And sometimes those points can have an even stronger effect than the local point in the meridian.
Yeah. Okay. So that's an acupuncture approach. So that would be like a distal. You can have a local approach with acupuncture and a distal approach, or a distal approach, right? So the local approach is like doing it right on the spot.
Yeah.
Would you use cupping distally, or do you only use cupping locally?
No, well, that's probably one of the main differences, is that for me anyway, I would use the cupping over the immediate area where the problem is, unless it's fresh injury, like obviously if there's no broken bones or or broken skin or bleeding or anything like that, but provided it's just like a muscle strain or muscle tension, put the cupping over the problem area and maybe some adjacent areas as well, because other muscles get pulled into it as well. And sometimes it's kind of helpful to trick the brain to do a few points around the area rather than focusing where that area of focus already is so intense.
Right.
So, but yeah, basically the cupping is very localized, whereas the acupuncture, we might incorporate those distal points as well.
Yeah, and look, lots of practitioners have lots of different styles. And like one practitioner, like Geoff was saying, he has got lots of different styles that he's been taught over the years. And sometimes on some patients you use this style, and you might go to a practitioner and they only do a certain style. They only do it the distal way. They only do Japanese style acupuncture. So it's worthwhile asking your practitioner if you're interested in that, or if one style hasn't worked, you can then use those other approaches along the track.
Other techniques, So and I guess another point of difference is that the cupping is similar in action to massage, which is different from acupuncture.
Yep. So it more gets a bigger area, right? Because the size of this, like one needle is going to be really tiny area that it gets. And this would be one of the biggest kind of cups that you can kind of get, right?
Yeah, and in fact, now that we're on that subject, I like doing a lot of sliding cupping.
Oh yeah.
So the cups can be put on stationary.
Yep.
And they just stay in that one spot, or we can put some oil on the body, on the back, and we can actually. You generally have to use less vacuum because it can be a bit painful. But with the oil, you can slide those cups along the meridians,
right?
Up and particularly up and down the back like that. It's people love that. And it's very relaxing, like mentally, like when you've had a really nice massage, but also very relaxing for those bigger muscles. Yeah,
right. Yeah, like that'd be like down your spine, so like your trapezius, your spinalis area, latissimus dorsi, those giant big muscles that like really get very tight and tense.
That's pretty much only where I would do it.
Yeah.
And I guess in that sense, it's similar to gua sha, which is another technique which maybe we weren't going to talk about.
Right, so different names for gua sha, like sometimes scraping, or they use a little spoon and they do the rubbing with the different implements. And it's kind of similar to cupping, except you don't have that suction on there, right? So another branch of Chinese medicine is Tuina, Chinese massage, and some of those techniques kind of blend similarly to those, and they're using more like the channels and a bigger area rather than one little area, right?
Yeah, and typically I will combine a lot of these techniques. So I might do acupuncture, might do cupping, and then I might do some Tuina, some massage after as well.
Yep.
Oftentimes I'll combine several of those treatments. We might do some cupping, and then we might do some massage afterwards, or maybe we do some acupuncture first and then massage, or all three combined.
Yep. So these are all different tools that most acupuncturists have. But I see, just like you probably see, lots of practitioners doing, let's say, dry needling, and they're not an acupuncturist, and they're disassociated from Chinese medicine or from the theory of Chinese medicine, right? So they might be a cosmetic practitioner and they're doing cupping. I've seen people do that. They do like that little tiny cup. This little tiny cup can actually go on people's face, like little little face cupping. So lots of these therapies are practiced, like we said at the start. They're not just part of Chinese medicine tradition, they're part of other traditions as well. And you see these therapies practiced, I see cupping a lot practiced by cosmetic practitioners. Like this little tiny cup can often go on the face as a cosmetic cupping. And what they do is they put it on and take it off very quickly. So they're just stimulating blood flow to the skin. Now, Chinese medicine practitioners do that as well for cosmetic treatments. They're not trying to bruise your face, but by causing all that blood flow to kind of come to your face really quickly, it kind of rejuvenates the skin, right? But what I'm getting at is like the important factor, I think, is the Chinese medicine diagnosis, because you could practice acupuncture outside of Chinese medicine and just call it dry needling. You're not really using it from that diagnostic framework. You could practice cupping outside of Chinese medicine and you're not really using it in a Chinese medicine way. But when we're sort of choosing which one we would use, it's more about, well, what does that patient need in a Chinese medicine diagnosis? Like, do they have blood stasis, and do you want to clear a lot of that local stagnation? Cupping might be a really great tool to kind of do that if the person's, like, you've checked their pulse and they've got more of an excess presentation, let's say. Whereas, like you said, some people that are elderly or
deficient.
Yeah, it's better. So people that are less robust might not tolerate the treatment as well. And that's only through Chinese medicine that you're getting that differentiation. Like, whereas these other practitioners aren't doing that, right?
Yeah. I guess if we're drawing comparisons, if you go and see a physio or a chiro, and they do dry needling, they're probably just going to be working on the local area and trying to resolve those knots in the muscles, which they can do effectively, of course, and we'll also do that as well. But we might also use those other points based on the theory of what those meridians do, what the distal points do to increase more blood flow through that area. Or strengthen and invigorate that person.
Okay, so this has been a really good comparison, looking at the difference between cupping and acupuncture. Hopefully you found this useful and helpful. And like, really, it doesn't mean that a practitioner has to use one or the other, right?
No, not at all.
Could they use both at the same time?
Yeah.
Having one treatment, like a practitioner doing cupping on you, doesn't mean they can't do acupuncture, right?
No. In fact, oftentimes we'll use them in conjunction. In fact, more often than not.
Okay, right. Yep. So this is something you could ask your practitioner about. You might have seen the video and you think, I'd like to see if my practitioner does cupping or does acupuncture. And at the end of the day, it's really at that practitioner's discretion. So I've had some patients come in and ask me before, which I don't know if you've had this, where people have asked, could I have cupping? And you've said, oh, that wouldn't be the greatest thing for the strategy of your treatment right now.
Yeah. Or they might want it on a part of the body that's Like, for example, they might come in and they've got hemorrhoids and they say, listen, can you do some cupping on my hemorrhoid?
It's not appropriate.
No.
We don't do that.
No. I was just going to say, like on certain parts of the body, the cups just aren't going to stick.
Yeah, that's true.
Right?
Yeah.
Like on an elbow, for example, or on the head.
Yeah.
You know, like we generally don't do... You can't do cupping.
Yeah, it's got to be safe as well.
Yeah.
And the other thing is your practitioner won't be competent or able to do it safely if that's not something that they regularly do. And like, there's lots of things where you might have been trained in it at the very start of your practice, but practitioners might not have the recency of practice in that particular area. Like I know some practitioners that don't use moxa at all, and they don't even stock it in their clinic. Just because they learned it in school doesn't mean they do it right now. So they might not be the best practitioner to do that on you if they're not, regularly doing that. But it's really interesting. I think the main thing about this channel is to help educate people a bit about why. So you might have had cupping and you might think, why did my practitioner do cupping on me today? And some patients I might do cupping for a couple of treatments and then not do it anymore. Because you don't need to do it every single treatment. Like you might do it for a purpose, like to move some of that blood stasis. And then after a while, you don't need to do it anymore. You want to really work on the channels like we talked about before, like the distal points. And one thing we didn't mention, sorry to butt in, but one thing we didn't mention is that sometimes cupping can actually make people feel really sore the next day. Have you found that?
Very infrequently, only once or twice. Like you mean flare up the condition?
It can do, yeah.
Or you mean just the cupping mark itself is...
Not the cupping mark sore. Like, I mean, sometimes you can feel that, but like if there are some conditions or there are some styles of treatment where we don't want to address that local area right now because it's going to cause more inflammation. And that's, I mean, acupuncture does that, and that's a part of its healing process is to cause more inflammation in the area to help it heal. And the same as if you had a massage, but there's some conditions where it might already be way too inflamed to inflame it up even more, right?
Yeah, and some people just, you get a pretty clear idea that it's not going to work for those people. So as a practitioner, we need to make those decisions about, are we going to do this or is it not appropriate in this case?
Yeah. So ask your practitioner about cupping and make sure that you follow their advice if they say that they would prefer not to do it on you at that time, because there's probably a reason for that. So thank you so much, Geoff, for sharing your knowledge. And
my pleasure.
Thanks so much, Geoff, for being on the channel and letting the audience know your knowledge, really sharing your knowledge with us. I think that's really great. It's been very informative today.
Yeah, my pleasure, Marie.
Awesome. So if people want to find your clinic or find out more about what you do, how can they find out?
Well, I'm currently practicing in a clinic in Netherlands called Floralia Wellness and Apothecary.
Awesome.
And it's that's where it is.
Awesome. So if you're in Perth, you can contact Geoff. We'll put his personal home address in the link below. No, we won't do that. We'll put your website.
Put my Tinder account.
Oh, you did that. You can swipe right on Geoff's clinic. No, we won't do that. We'll put Geoff's website address in the link below, and you can click on that, find out more about what he does and the style of treatment that he does, if that's right for you. Cool, awesome. Well, have a great day, and don't forget to subscribe to the channel if you've got a question about Chinese medicine that you'd like answered. Maybe you'd like us to talk about a different topic, moxibustion, cupping, acupuncture, herbs, gua sha. We've mentioned lots of those things today. So pop your question in the comments below, and we will attempt to answer it. Thank you.
Thank you.
Thanks for listening to the Chinese Medicine Podcast. Did you know we're also on TikTok? And you can find shorter videos on Facebook and Instagram that you might like to share with your friends and family. You can also find our podcast on Apple, Spotify, and all places where you listen to audio podcasts. I look forward to seeing you again on the next video soon. This little tiny cup can actually go on people's face, like little face cupping.
Which would be really attractive for afterwards with all those bruises and marks. You look like a golf ball.
Oh my god.
Why are we talking about someone else, other modalities?
Because I want to draw the attention that it's part of Chinese medicine.
Oh.
And that's only through Chinese medicine that you're getting that differentiation. Like, whereas these other practitioners aren't doing that, right?
Yeah.
Feel free to comment.
Well,
I'm trying to give you a thing to comment on.
Oh.
And, like, really, it doesn't mean that a practitioner has to use one or the other, right?
No, not at all.
Could they use both at the same time?
Yeah. I think we covered that before, didn't we?
Just It's good to reiterate it. This is going to be a soundbite. Let's go with it.
Yeah.
Look, if you've had scraping or spooning, that's called swab.
Not that kind of spooning.
There's going to be some great bloopers on this.